What's up, guys? Welcome to the channel. In this video we're going to talk about infectious diseases and wearing gloves to help protect against the Wu flu. Alright, so I know the coronavirus or COVID-19 or whatever you want to call it, Wu flu, Chinese virus, it's all the same thing. Anyway, a lot of people are being forced or told or decided to wear at least some kind of cloth mask or paper mask or N95, whatever you want to wear. A lot of people are also deciding to wear latex or nitrile exam gloves to help prevent themselves from getting the Wu flu. And the main thing about that is most of the people that wear the gloves, I don't think understand how nitrile gloves play a role in isolating bodily substances or infectious diseases, that sort of thing. Wearing gloves like that is not just a one-time thing. You put them on in the morning and your hands stay clean all day long, and you're not going to get infected from an infectious disease or bodily substances. That's just not the case. These are made to be disposable. They're like one-time use, one patient use. You're not even supposed to go from patient to patient with these. So what I mean by that is, say you go to Walmart and you've got these gloves on. I've seen people driving the car with masks and gloves and all that stuff. So, when you're outside, your gloves are on. They're getting contaminated with the outside environment. You touch your door handle, your steering wheel, getting contaminated. You touch the door, the buggy at Walmart, whether you wipe them or not, still getting contaminated. You touch bags and stuff all in Walmart, the clothes, the cash register. You don't touch the register, but the area around it where all the other people are touching, your gloves are getting infected. And guess what you're doing the entire time you're in Walmart? You're touching your face, you're adjusting your mask, you're touching your phone, you're looking at your phone, you're pulling out your wallet, your debit card, all this stuff. And all you're doing is touching it with these infected gloves because you think the virus is not going to get you because your hands are covered. Well, the reason medical professionals and stuff and EMTs and all wear gloves is so when they're working on a patient, the infectious stuff or the substances or whatever, they get on the glove, and then when they get done, they peel the gloves off and throw them away. Their hands stay clean. When you're working with a patient, and you got blood on them, you're trying not to touch your face, you're not touching anything else but the patient because you've got blood on them. You're not wearing those same gloves all day long because they're contaminated. You're supposed to get rid of them after each use. So if you want to wear gloves to help prevent, catching a disease, first, you're not going to catch it through your hands. Your hands, it doesn't matter what's on your hands. What matters is where your hands go after that. They're going to touch your face, your eyes, you're going to rub it, you're going to pick your nose, whatever. That's how the virus is going to get from that surface to your hand, to your face, and into your body. That's how you're going to catch it, not just by touching it with your hand. But anyway, if you want to wear gloves to help prevent that, say you go to Walmart, put the gloves on. When you get to Walmart, do your stuff in Walmart, try not to touch anything. And then when you get out of Walmart, peel them off. I'm going to show you the proper way to dispose of or to get rid of, doff, if you will, protective latex or nitrile gloves. There's a few different variations of this technique, but it's pretty much the same thing. I'm going to show you how I was taught how to do it. Alright guys, so I'm going to try to get as close behind this tripod as I can so I can get my hands out here to show you. Putting the gloves on is just simple. Put them on. I really hope I do this right because I'm on camera and I'm telling you guys how to do it, and I hope I don't make a fool of myself. Okay. So you've got your gloves on. They're dirty, they're full of COVID, they're full of Wu flu, whatever. First thing you're going to want to do, I'm trying to look through the camera also. Pinch the top part of this, don't touch the inside. Pinch the top part of this, pull it down to the fingers and expose some clean area and the fingers. What you want to do, leave the thumb out. Pinch this one the same way, roll it all the way out, and then try to grab all of it like that. Then you can throw it away. I'm still touching the clean parts of the glove. All right, so that was one way to do it. That was kind of awkward because you're having to pinch and remember, try to figure out what's clean, what's not, what's the inside, what's the outside. So another way to do it is to pinch this one like all the way out like that, and then go behind, pull it apart, go behind that one, and then just roll it all out like that. And there you go. The dirty glove is inside. This is the clean inside of that glove and didn't touch anything. All right, one way you can practice those techniques is to go home. Well, I don't guess you have to go home because you're probably watching this at home. Anyway, to practice these techniques, put some gloves on and get your wife or your kid or whoever to put like some shaving cream, just something you can see really easily. A lot of times when we learn it for like medical classes, it's shaving cream. Put the gloves on, put shaving cream in the palm, cover front and back everything with shaving cream and make sure they're completely covered, and then take both gloves off. And then when you get them off, your hands should not have shaving cream on them. If you get done, you got shaving cream anywhere, you did it wrong, because that's technically like getting a disease on your hands and then you're going to touch your face or whatever. So that's a good way to practice it. Bit my lip. So those are two techniques, and that's a good way to practice it with shaving cream. So yeah, try that next chance you get. So yeah, guys, these nitrile gloves are not going to protect you from getting any kind of virus if you don't know what they're used for and the proper usage of them. If you think it's just like a new pair of skin, or it's just a layer that's going to protect your skin on your hands, that's not what they're for. It's not what their use is. It's to keep the germs and the contaminants on one surface that you can dispose of later, and you have clean hands. And also, when we get done using these on a patient or whatever, you ditch them, throw them away in a waste or biohazard or whatever, and then you still use hand sanitizer or wash your hands or whatever. In the hospital, they got sinks everywhere. Wash your hands. If you're out on a truck or an ambulance, use hand sanitizer, whatever. So what I'm trying to get at is the gloves aren't going to do what most people think they're going to do. Hand sanitizing is probably a better alternative. Just before you get to a store or out in public, use some hand sanitizer, keep it in your car, especially when you get out of the store. If you got it in your pocket, squirt some on, rub it around, all that sort of thing. It's probably going to do a lot better than wearing the same old dirty gloves all day long and touching it all in your face.